So we have been developing a regimen called TEDDI-R for patients that have aggressive lymphomas that are involved in the central nervous system. So this is a very much an unmet need. These patients frequently are excluded from clinical trials, and they have a very poor prognosis with standard treatment. So TEDDI-R is chemotherapy in addition to Ibrutinib, and we know that Ibrutinib works in about half the cases of secondary CNS lymphoma. So we first tested Ibrutinib to see how many times that the patient would have a response. If they responded to Ibrutinib, then they got the full TEDDI-R regimen. If they had a tumor that didn't respond to Ibrutinib, then we gave them the chemotherapy part, but we didn't give them the Ibrutinib. This is a way to kind of tailor therapy to the response to targeted agents, and therefore, avoid some of the toxicities we've seen with these drugs. What we're showing is that certain patients that respond to Ibrutinib actually have very long remissions after TEDDI-R, possibly even achieve cure, which is to say they've gone at least 3 or 4 years and they've not relapsed. But that's mostly in patients that have a certain type of secondary CNS lymphoma, and there's other patients that don't benefit from this regimen as much. We're trying to come up with different therapies for those patients.